of Kai Deepika, the national level online alumni CME series organized by the Department of PG and PhD Studies in Kai Chikitsa, SDM College of Ayurveda Hospital and Research Center, Udupi. As the name itself suggests, Deepika, the lamp which signifies light, knowledge, and clarity. Just as a lamp removes darkness, this series aims to illuminate our understanding of clinical practice and research in Kai Chikitsa through the wisdom of our revered alumni. This initiative is a very special as it is not only strengthens the bond between department and its alumni, but also creates a vibrant academic platform for exchanging experiences, clinical
स्पीकर सही
insights,
नहीं है
and new perspectives. It is truly a celebration of learning that bridges the past, present, and future. With these words, let us
मैम कौन
begin
सी
this
आईडी सर
journey of knowledge sharing. May Kai
आईडी आईडी
Deepika continue to
आईडी
enlighten
कौन
us
सी है
all and strengthen the roots of Kai Chikitsa. To begin this auspicious gathering, we seek the blessings of the divine. I would
मैम
like to
एक
call upon Dr.
एक
Anjali and group for the invocation.
शम्भो गिरीशा सुरपूजितकामभैरि गौरीश शङ्करा महेश्वर विश्वहेतु शम्भो गिरीशा सुरपूजितकामभैरि गौरीश शङ्करा महेश्वर विश्वहेतु धर्मस्थलेश सकलेश दयापयोदे श्रीमञ्जुनाथरितला कुरु मङ्गलं मे धर्मस्थलेश सकलेश दयापयोदे श्रीमञ्जुनाथरितरा कुरु मङ्गलं मे कुरु मङ्गलं मे कुरु मङ्गलं मे.
Now, I kindly invite Dr. Shreyashri Ma'am, Assistant Professor, Department of Kai Chikitsa, SDMCA Udupi, to deliver the official welcome address.
Om Shri Manjunathaya Namaha, Om Shri Dhanvantare Namaha. A warm good afternoon, everyone. STM College of Ayurveda Hospital and Research Center says our alumni, our pride. Our institution has the history of 70 years in UG and 25 years in PG teaching, with a huge strength of alumni crowd shining brightly all over the globe as entrepreneurs, administrators, academicians, practitioners, researchers, and in different identifiable positions. With this background, we are here today for the national level CME Series 2 Kaya Deepika. It is my immense pleasure to extend a warm welcome to all of you to the national level online alumni CME Kaya Deepika Series 2. We are truly delighted to have our esteemed alumni, faculty members, PG scholars, and all the participants join us for this enlightening session. We are honored to have our today's guest speaker, Dr. Madhusudan Aike, Principal of PNPS Ayurveda Medical College, Kanangad, and a distinguishable alumnus who completed his post-graduation in the year 2006 and has an enormous experience in the field of Rasayana. Your presence adds great value to this CME. We welcome you, sir. I would also like to welcome our beloved principal, Dr. Mamata KV Ma'am, our vice principal, Dr. Niranjan Rao, deans, HODs, and all the faculty members to this event. A special welcome to all alumni, practitioners, PG scholars, internees, UG scholars, and all the participants who have joined us today. Once again, a warm welcome to one and all. Thank you.
Thank you, ma'am. Now I kindly request Dr. Shailesh sir Assistant Professor, Department of Kaya Chikitsa, SDMCA Udupi, to formally introduce our speaker of the day, who is a shining example of our department's legacy.
Good afternoon. Today we have with us our own alumnus, Dr. Madhusudan IK. Dr. Madhusudan IK completed his post-graduation at STM College of Ayurveda, Kutpadi, Udupi in 2006 in Kaya Chikitsa specialty. He has been a resource person. He has been a resource person in many of the national and international seminars organized by various reputed institutions like STM College of Ayurveda, Kutpadi, Udupi, All India Institution of Ayurveda, Delhi, PAMC, Kannur, Kerala, etc. He has been a decorated chairperson in PNNM Ayurveda College, Shornur, Kerala, Vaidyaratnam Ayurveda College, Ollur, Kerala, and GAF, Tiruvananthapuram, and he was an expert member for framing CBDC Kaya Chikitsa subject. Presently, he is working as a principal at PNPS Ayurveda Medical College, Kanangad, Kasaragod, Kerala, and also a ethical committee chairman at MVR Ayurveda College, Kannur. We are very delighted to have such an eminent speaker alumnus with us. With this brief introduction of resource person, I request Dr. Amrita to carry on the proceeding. Over to you, Amrita.
Thank you, sir, for the wonderful introduction. And now it is my great privilege to invite our esteemed resource person, Dr. Madhusudanan, sir, to take the virtual stage for the talk on an appraisal of Lashana Rasayana in Vata Vyadhi. Over to you, sir.
Hello.
Yes, sir, you're audible, sir.
Shall I share the screen, ma'am?
Yes.
The screen is visible now, ma'am. Hello.
Yes, sir, screen is visible, sir.
Shall I start?
Yes, sir.
Namaste. Ragadirogan Sadadanashaktan Asheshakaya Prasrudan Asheshan Outsukya Moha Aradidan Jagana Yo Apuro Vaityaya Namostu Tasmaihi. My humble pranama to my Guru, Dr. G. Srinivas Acharya sir. He was my guide during my post-graduation studies. Respected Sheelata ma'am, head of the Department of Kaya Chikitsa. She was my co-guide during my post-graduation study. All the faculties in the Department of Kaya Chikitsa and postgraduate students and other UG students and all other doctors and my dear friends. Today's my topic is an appraisal of Lashana Rasayana in Vata Vyadhi. Coming to the introduction, diagnostic approach has seen various mens in every epoch. The diagnosis and treatment are now being viewed in a new stream of life. As an Ayurvedic physician, the Vata Vyadhi Chikitsa is one among these. Here, especially, here comes the topic of Anukta Roga. So there are so many diseases that is not explained in our classics. That is also some of the disease we can included under Vata Vyadhi. So example is post-COVID pain and chikungunya, etc. So the Shodhana, Shamana and Rasayana Chikitsa are considered as the complete treatment of Vata Vyadhi. So if the doctor practicing in this sequence, Shodhana, Shamana and Rasayana Chikitsa, there won't be reoccurrence of the disease. That is, Acharya says, Desham na punarbhava. So it is called as apunarbhava Chikitsa. So For this, here comes the importance of Rasayana Chikitsa in Ayurveda. So the procedure by which Rasadi Saptadhatu are satisfied in all respects through proper nourishment is known as Rasayana. So these are some example for Vada Rasayana. It can be given in case of Vada Vyadi. Ma'am? Hold, it's not lonely part is coming. Huh? Yeah, sorry. Okay.
Hello.
Now, how is ma'am? Hello. I just have one thing. I'll stop share. Hello, ma'am. Now, hello. Now it is okay, ma'am. Okay, okay, okay. Okay, okay, okay. Hello. Ah, okay. Okay. From last point onwards, no, ma'am. Introduction is over. Okay.
Go for Google Meet. पिन गूगल मीट को पिन कर
Hello. Hello. Hello, ma'am. Hello.
Yes, sir, it's audible.
Shall I continue? These are the main rasayana which is used in case of Vadavyadi. So before giving the rasayana, we have to select whether the disease is due to Dhatukshajanya or Avaranajanya. So this Lashana rasayana that is clearly explained by Vagpada, and Chitraka rasayana also explained by Vagpada, and Kukudi rasayana that is a speciality of Ashtanga Sangraha, and Shilajat rasayana, Gugul rasayana, Chavana Prasha, these are explained under Avaranajanya pathology, and Brahmyadikrita rasayana that is a speciality of Kashya Samhita, and Bala rasayana, Nagar Bala rasayana that is explained by Charaka, etc.
Next ಅಂತ ಹೇಳೋಣ ನಮಗೆ ಚೇಂಜ್ ಅಂತ ಹೇಳಿ.
Next slide please.
ಗೂಗಲ್ ಮೀಟ್
Next slide ma'am. Why Lashana rasayana is best among all other rasayana? Next slide ma'am. Next slide ma'am. Next slide ma'am. So according to American author and motivator speaker Leo Buscaglia, he says there are many miracles in the world to be celebrated, and for me garlic is the most deserving. Next slide.
ಅಲ್ಲಿ
Next slide ma'am.
నెక్స్ట్
Next slide ma'am. So this is a explanation we will get from the Samhitas. Vagpada says Sakshat Amrita Sambhude Gramani Rasayanam. That is the rasayana, that is the Lashuna that is obtained from nectar. So it is called as rasayana. As per Acharya Kashyapa says, Lashuna is having unique quality, that is Srodasamcha Vishodhanam. Next slide. Next slide, please. So this is about the Lashana Prayoga Kala. That is when, which Kala we have to give the Lashana in the patient. So
ಬರುತ್ತೆ ಸ್ವಲ್ಪ
Shita Kala is considered to be the best Kala to administer Lashana Rasayana. And if you want to give the Lashana in Vasanta Kala, if the patient is having Kapha Ulbhana Vyadhi, and if that Varsha Radu is considered to be the best Kala, if the patient is having Vada Roga, that is the Pragopa, Vada Pragopa takes place in the Varsha Radu, that condition also we can give Lashana Rasayana. But the main thing is always the person should follow Grishma Rudacharya. Next slide, please. And next about the indication, which are the persons are indicated for giving Lashana Rasayana. So first about the Nidana, how the disease is produced according to Nidana base. Shita Vada Hima Dagda Tanunam. That is the person have the disease because of the Shita Vada or Shita Hima. Because of that, if the roga is occurred, that condition you should not go for, you have to give Lashana Rasayana. And next about the structural deformity. If the patient is having Stabda, Bhagna, Kudila, Vyavasthita Asthanam. So if there is deformity or if there is a rigid or loss of movement or fracture or curved or painful bones, that condition also we can give Lashana Rasayana. And all the Vada Vyadhi we can treat with the Lashana Rasayana. Beshajasya Pavano Bahidanam Bhakshande Vidhirato Lashanasya. Next slide, please. So these are the contraindication in the time of Lashana Prayoga. So here the Ahara Vihara that indicates the Kapha Vada Karanidana, that is Amabupana, that is uncooked water, and Ikshuvikara, Matsya, Yana, Adwa, Adava Sevana, these are the Vada Karanidana, Adhiga Bhashya, Adhiga Chindana, Divasopna, that is the Kapha Karanidana, Jagaranam Nishashu, that is Disha Jagarana, that is Vada Karanidana, Pishta Bhojana, and Vyavaya, Adiga Vyavaya, and Dadi Sevana. These are the contraindicated things in the time of Lashana Prayoga. Next slide. Some Roghavastha, you should not go for Lashana Rasayana. That is especially Pandu, Udhara, Urakshada, Shofa, Trishna, Panatiya, Chardi, Visha, Vraneshu, Pitte Vikare, Akshiroge, Adisare, Shame Sharire, especially the Pittaja, Roga, you should not give Lashana Rasayana. So if you consider the Pandu, example is Pandu, if the person is having Pandu and the person is having, person developed Vada Vyadhi, because in case of the Nidana, while explaining about Vada Vartaka Nidana, Ruksha Shitalpa Laghvanna, etc., Vishamad Upacharacha, Doshasra Sravana Adhi. So Adhiga Sravana, that will lead to Pandu. The Rakta Adhisravana, that will lead to Pandu. Pandu, that will turn into Vada Vyadhi. So if the patient comes with you and patient is having Vada Vyadhi, but in that condition you have to see the hemoglobin level. HB level you have to think, you have to check. Then you can select that the person is suitable for Lashana Rasayana or not. Or you have to assess the Pandu Lakshana, that is so alparakto, alpamedasko, nisarakaha, shidilendriyam, vaivarnyam bhajade. These are the Lakshana, the Pratyatma Lakshana we can see in case of Pandu. That also you have to observe in case of Vada Vyadhi. Next slide, please. So next about the Puro Karma, what are the preoperative measure you have to do in case of before giving the Lashana Rasayana. So after the Snehana and Shodhana, that is first you have to go for the Snehapana and Shodhana and Shita Madura, Ahara and Aushadha Sevana, and almost all the things that is explained under Grishma Ruducharya or Pittasya Upakrama, that is surrounded by attendants who were, that is garland, they have to earrings, etc., etc. So this is the Pittasya Upakrama you have to follow in the time of administering Lashana Rasayana. Next slide, please. So duration, dose and Aushadha Sevana Kala. How many months, how many days we have to give Lashana Rasayana? That is Masaha Paro Asya. That is Parama Masa is called as 1 month. The best time is 1 month. But according to some, Shanmasa Anya Vidhina, according to some says The 6 months also possible, but it is called as Nata Shastamahu. It's not good. Actually, we can administer Lakshana Rasayana up to 6 months also, but it's not good for the body. So Paksha Prayoga Hinataram, that is 15 days also possible. That is also considered to be the duration for administering Lakshana Rasayana. Next slide, please. Am I audible, sir? Hello? Please answer.
Yes, sir, you are audible,
Hello?
sir. Yes, sir, you are audible.
Hello? Am I audible?
Yes, sir, you are audible, sir.
Okay. So this is about the dose. The swarasa, then the swarasa and madhira. If it is mixed with this madhira, then the dose is 1 kudava, that is 192 ml. And kevala Lakshana matra swarasa is called as half kudava, that can be called as compared with 96 ml. And Lakshana majha matra, that is called as the 1 pala or 48 ml. So the numerical dose that is explained by Kashyapa, that is Uttama Matram is Shatam, that is 100, Madhyama Matram is Shashti, and Shathartham is called as the Avara Matra, that is 50. Next slide, please. The Aushadha Sevana Kala, that is also clearly explained by Vagpada, Sabaktam Pragbaktam Chashilayet, that is along with food or before food, you can administer Lakshana Rasayana. Next slide, please. Next, about the collection and preparation. The Lakshana Kanda should be collected in Vasanta Rudu, either from the region of Shida Desha or Shaka Desha. Then the husk is removed. It should be soaked in Madhira for overnight. Next day morning, the Kalka Swaras is prepared and should be mixed with 3 parts, either Madhya, Takra, Mastu, Kanji, Taila, Sarpi, Vasa, Majja, Shira, Mamsarasa, or any Kwada appropriate to the diseases or the Kalka Swarasas. Next slide, please. This is called as the test dose. So Gandusha Matra should be consumed in empty stomach for Kanda Nadi Shuddhi. If there is no complication or the complication have been subsided, then the remaining medicine can be given. That is, Acharya says, Pibet Gandusha Matram Prak Kanda Nadi Vishuddhaye. This can be called as the test dose. Next slide, please. So, because we should not give, that is test dose, after the test dose, and we are giving slowly, we can administer the Lakshana Rasayana. So Acharya says, Raso Agni Kalpo. So this Lakshana Rasayana is Agni Tulyam. So that will hamper the Mruduna Ojasa, Ojo Nasha will be there. And if you are giving the Lakshana Rasayana to suddenly, that is Torido na Yunjya, suddenly you should not administer Lakshana Rasayana. That is, if you are giving quickly, that is starting from the high dose, if you are starting giving the Lakshana Rasayana, that will produce us the Daha, Adisara, Aradi, Chitta Nasha, etc. in the patient. So that you have to start with the lower dose, then you can gradually, Kramadaha Vriddhi, you can follow while giving Lakshana Rasayana. Next slide, please. So this is the method of administration. Usually we are practicing in Kerala. That is, we are dividing the masa into 4 weeks. The first week, we will give Lakshana Rasayana 12 ml with Anupana, even though it is Shira, 36 ml. And totally there will be 1 pala, that is 48 ml. Second week, we will give 24 ml and 24 ml Anupana, and totally 48 ml. And third week, 36 ml of Swarasa, Lakshana Swarasa, with 12 ml of Shira or Anupana, and totally that will become 48 ml. And last week, only Lakshana Swarasa we will give. Next slide, please. So next, about the complication, and if the patient is having Vedana during the time of Lashana Seva, that is Pratadam Swedanam, continuous Vedana should be administered. And if the patient develop Vami, Murcha, etc., then Shitambu Sega is considered to be the best. And if the patient Vidaha Pariharasya, that is, if the patient develop the Vidaha, then Shitanu Lebana should be administered. Next slide, please. And after the complication, after giving the above treatment, after the complication subsides, then Shesham Pibet Klamapaye Stiradam Gada Ojasi. That is, remaining dose we can give after getting the Klamanasha, and there will be Stira of Ojas, then we can give remaining dose. Next slide, please. This is about the Patyavatya in the patient. After the administration of Lashana Rasayana, this should be followed. This is our Bhojana. So here Jirna, that is after the Jirna of Lashana Swarasa, Shalyodanam Jirne, that is Jirna Shali should be administered, and the color of Shali should have the white color, just like Shankha, Indu, etc. And it should be mixed with the Yusha, Shira or Dhanno Mamsa. Next slide, please. And this is about the Pana. What type of drink should be administered in after giving the Lashana Rasayana? Madhyamegam Pibe Tatra Trit Prabandhe. That is, if the person having Trishna, then Madhya is considered to be the best choice after the Lashana Sarasa, Lashana Prayoga. So, otherwise, Jalayukta Madhya also considered to be best. And if the Amadhyapan, that is, if the person is not like Madhya, that person we can give Aranala, Falambu or Parisiktadam, that is thin gruel also we can give for Trishna Prashamana. Next slide, please. So this is about the Paschat Karma. So this ends the Lashana Prayoga. That is Pitta Kopa Bayadande Yunjyat Mrudu Virejanam Rasayana Gunanevam Paripurnan Samastude. That is, after giving the Lashana Rasayana, after the Lashana Prayoga, the patient will develop Pitta Kopa in the body. So to get rid the Pitta Kopa, we have to go for the Mrudu Virejanam. And here, this will end the Lashana Rasayana. Next slide, please. So this is one case report that in our hospital, that is 70-year-old male patient complains of bilateral hand tremor, impaired memory, slurred speech, movement difficulty, slowness of activities, fatigue, and irregular and obstructed bowel movements over the past 2 years. Complaint was gradual with initial manifestation of fine tremors in the hand, mostly while engaging tasks like holding utensils, etc. Later, he developed reduced memory, slurred speech, movement difficulty, slowness of activity, fatigue, and irregular and obstructed bowel movements. He consulted with an allopathic doctor and diagnosed as Parkinsonism. For better treatment, he was admitted in our hospital. Next slide, please. So past history of diabetes mellitus 10 years, and he's on medication Sindopa plus 1 TAD and Clopivas 75 OD and Pacitan 2 mg OD. Next slide, please. So the investigation MRI report that shows mild degenerized cerebral atrophy along with chronic ischemic changes affecting the bilateral frontoparietal and periventricular white matter. Next slide, please. So it is diagnosed as Kambavada. Next slide, please. So this is about the Dogi Nirikshana. In this particular case, I have observed the Satmya. The patient can able to take Lashana. The dosha is Kapha Vada dosha in this particular patient. Dusha is Rasa, Mamsa, Medha and Asti, and not having any Pitta or Rakta Lakshanas. So that I decided to give Lashuna Rasayana in this particular patient. Next slide. So these are the internal medication I have given in this patient. So first this Gandharvasadi Kashayam, that is along with the Saindavangula, that is Kwadaha sa Saindavagulam Pavanasya Shande, Vaine Balaya, Ruche Malachodhanaya. So this is a Vada Vyadi, and that if you are giving Gandharvasadi Kashayam, that will have Pavanasya Shande, that is Vada Vyadi Nashana property, as well as Malachodhanaya. The patient is having the Shodhana, there will be difficulty in passing motion, so that the Gandharvasadi Kashayam to be best, and it has been given 15 ml plus 45 ml of lukewarm water before food. And second, I used Dhanada Nayanadi Kashayam, that is here also Shamayandi Paripidam Sa Ardida Akshepakan Vyadin. So especially the Ardida Akshepaka etc. Vyadi. So whatever the disease that will have involuntary movements, that condition we can use Dhanada Nayanadi Kashayam, that is given 15 ml plus 45 ml of lukewarm water. That is also given before food. And Kabigacha Churna, Mahavada Vidvamsa also considered to be best for here. That is 5 gram with lukewarm water, and Mahavada Vidvamsa 1 PD with lukewarm water, both given after food. Next slide, please. Next slide, ma'am. So these are the Purva Karma. Next slide. So first 1 to 5 days I have given Udvartanam with the Kola Kulatadi Churnam. So the observation was the rigidity slightly reduced. And 6th day to 10th day Abhyanga with the Mahamasha Taila and Udvartana with the Kola Kulatadi Churnam. So this is something about the Vyatyasa Chikitsa. So it's clearly explained in Anyonya Varna context. So the Vyathyasat Karyet Sarpi, or Vyatyasa Chikitsa, if there is Shita Ushna or Ushna Ruksha, etc., continuously administration of this particular therapy. So that is considered to be best in case of Avarana. So after giving this, the patient feels lightness of body, sleep improved, and appetite improved. And 11 to 17 days, the Snehapana with the Masha Taila given, and Samyak Snidhada observed, and 18 to 20 days Abhyanga with the Mahamasha Taila and Bashpa Seda was given, and 21st day Virechana with the Trivurth Lekhya 20 gram and Samyak Virechana Lakshana observed. Next slide, ma'am. This is about the Rasayana Prayoga in this particular case. Next slide. So we for 1 month course, and the fixed dose is 48 ml, and selected Aushadha Sevana Kala as Prag Bhakta. Next slide, ma'am. So 1 to 7 days, 12 ml of Swarasa, Lashuna Swarasa is given, and with the Shira, that is 36 ml. And next 7 days, 8 to 14 days, for 24 ml of Lashuna Swarasa and 24 ml of Shira is given, and the patient complains of burning sensation in the abdomen. For that, Shankavati and Kamaduga Rasa before food it was given. And 15 to 21 days, 36 ml of Lashuna Swarasa and 12 ml of Shira, and there also the patient complains of burning sensation in the abdomen. Same medication is given. And 22 to 28 days, because the patient feels very difficult to drink the Swarasa in the Pragbhakta, so that I have changed with the Sabhakta. And Shira Anupana, that is Lashuna Swarasa 48 ml, and it's not mixed with the Shira. After drinking the Lashuna Swarasa, I have given the Shira as Anupana. And 29th day, that is Prayogande Mrudu Virechanam. That is Mrudu Virechana with is given with Avipatti Churna. That is the Avipatti is considered to be the best Churna for the Pittaja Vyadi. Avipatti Rivam Namna Prashasta Pitta Roginam. So that I have used Avipatti Churna for this particular patient. Next slide, please. Result: tremors in bilateral upper limb reduced, and patient is able to walk comparatively better. and feeling of falling down while walking reduced. Next slide, please. Discussion. The primary etiological factors contributing to Vada Vyadhi include Dadukshay and Margavarana. In Basavarajya, Kambavada manifest symptoms such as Karapada Tale, Kambe, Nidrabhanga, and Shinamati, all of which align the classical Vadaja Lakshanas. Also, the patient also exhibit Parvagraha, Astigraha, Vaksgraha, Kuruda Anga, Skalidamcha Gadobrisham, indicative of Lakshanas of Kaphavrta Vyanavada. Next slide, please. Therefore, the treatment approach focused on removal of Kapha Avarana initially. The Udvartana dust Kaphahara, with its ability to enhance Tikshnagni, felicitate the optimization of Uttarottara Dhatu functions. The internal administration of Gandharvasadi Kashaya proved beneficial for Amapachana, Agni Deepana, and Vadanlovana. The Tanata Nayanadi Kashaya, Kapigacha Churna, and Mahavada Vidamsa Rasa are traditionally used for neurological and joint diseases. Next slide. The incorporation of Ayurvedic treatment procedures coupled with Rasayana therapy demonstrated a notable changes in the patient. Due to Vadahara and Rasayana property, it helps to rejuvenate the body tissue, improve the motor and sensory functions, strengthen vital elements. Next slide, please. The Lashuna act as anti-thrombotic agent, act as hypo as well as hypertension, acts against atherosclerotic bleed, act on nerve entrapment pathology also. Thus, Lashuna is considered as the best drug to treat different Vada Vyadhis. Next slide, please. Finally, the Lashana is considered to be Shrodho Vishodhana Rasayana and Kaphavada Shamaga Guna, and especially used in Kapha Medohara Pradhana Vada Vyadhi, and it is considered to be the best Rasayana. The Lashana is easily available drug, but its potency is very high and high medicinal value. And if it is used with strict rules and regulations, it can be also used as a single drug for as Rasayana. So that the quotation Bahukalpam Bahugunam Sambannam Yogyam Aushadam is very, very suit for especially for Lashuna. Thank you. Thank you, Anna. Thank you, Dr. Sheelata ma'am and whole team for giving me an opportunity to present my knowledge, share my knowledge with you people. Thank you.
Thank you, sir, for this truly informative and enlightening session. Now the session is open for discussion. If you have any queries, post in our WhatsApp group.
If any clarification is needed, I will try my level best to clarify you.
Sir, there is one query. When Lashuna Rasayana is given in Swarasa form, should it be mixed with Anupana or given separately?
One question from Dr. Ramesh HS. During administration of Lashana Rasayana and Shodhana, whether you have stopped allopathic Parkinson's medicines? and also regarding his allopathic diabetes mellitus medicine. No, sir, I'm not. I want to get more result to the patient. I'm not ready to stop the medicines. I'm not stopped.
Sir, there is one question. When Lashanarasana is given in Swarasa form, it should be mixed with Anupana or should be given separately.
Sir, Dr. Madhusudan, sir. Dr. Madhusudan, sir. Dr. Madhusudan, sir.
Any other questions?
Sir, we will be asking the questions are posted in WhatsApp group. So we will be reading it out to you. Is that okay, sir?
Hello, sir. There is a query. When Lashana is given in Swarasa form, should it be mixed in Anupana or should be given separately?
Uh, the answer for the Dr. Meghna's question. So we can, I'm not stop the medicines, and we can give the Lashana Rasayana in case of hypertension because of the chemical constituents allicin that will exhibit the antioxidant, and it is considered to be anti-inflammatory and neuroprotective action. And if you're considering the Ayurvedic aspect also, and Ayurvedic aspect, if the Rakta Bharadikya, if you are considering the as hypertension, and there won't be Dravyadaha and Gunadaha and Karmadaha Vriddhi will be there, but we cannot see any Dravyadaha or Gunadaha Vriddhi in case of hypertension, and there may be Karmadaha Vriddhi, so that so that we can give especially and the Lashan Rasayana in case of hypertension also. And also when the another question, when Lashuna is given in Swarasa form, it should be mixed with Anupana or given separately. So here we are practicing. First day there will be the Lashana Swarasa mixed with more quantity of Anupana, and second week there will be equal quantity, and third week the Swarasa is more but Anupana is less, and last week Lashana alone we are giving, but it feels somewhat difficulty to drink that much of quantity of Lashana. So that I will give the Swarasa, that is the Shida, as Anupan after that.
Sir,
And question answer of Dr. Swati: can Lashana Rasayana be administered in ankylosing spondylosis, and what Ayurvedic measures can help in limiting the progression of the disease? So here, while explaining about the indication, Bhagna Kudila Vyavastidam Astanam. So wherever there may be deformity, that condition we can give Lashana Rasayana, but the condition is there should not be involvement of Rakta and Pitta dosha. Other conditions we can give Lashana Rasayana. So there will be relief, there will be progress, or there will be some relief by giving Lashana Rasayana in case of ankylosing spondylosis. And Dr. Meghana's question, that is, in that patient diagnosed as Kambavada, administered with Gandharvasadi Kashayam with the Saindavan Gula, the patient is diabetic, can we advise Gula in that patient? So this the quantity is very less than if you want to get more result for Gandharvasadi Kashayam, Padaha Saindava Gulam Pavanasi Shante. That is, Saidavan Gula is considered to be, it should be mixed with as Prakshepaga Dravya. That is, quantity is very less. It won't produce any diabetic level in the patient. And another question, can we administer Lashana Rasayana in OPD basis after Nitya Virejana? Sure, 100% sure that I have given this, but the condition is patient is able to Klesha Saha. The patient can tolerate the quantity, and whatever the any complications are there, that the patient have to tolerate. Another question, the Gandusha Matra, how much should be taken for Kanda Nadi Shuddhi? That is on almost 1/10 quantity. That is very less. You have to test dose, and we have to give the test dose. And after that, if the patient is not able to, don't have any complication, then remaining dose we can give. And another question, can we use Lashana Rasayana in Amavada? Sure. And if there is Ama and Vada, even though there is Ama, that condition also we can give Lashana Rasayana. Chetan Gadde, Dr. Chetan Gadde, the question is which variety of Lashuna is prescribed? There will be any medical value difference. Nowadays, farmers are using fertilizer such as some pharmacies. So actually, there are two variety of Lashana, Girijam, Kshetrajam, Chaiva, Dividam, Lashanam, Srutam. So here, Amurdena Samam Purvam, the Girija is considered to be Girija type of Lashana is considered to be just like Amrda. And if it is not available, another version that is Kshetraja also we can use, but the fertilizer that we have to collect it from the person, they are not using fertilizer. And pharmacy, that SDM only we are preparing, and one studies already done with our GSSR, that is Lashuna capsule has given, that is 500 mg into 6 gram daily with the Shira Anupana, that is given. Another question from Rashmi Moshi. Namaste, sir. If a patient is not able to complete the course of Lashana Rasayana, then can we withdraw in between, or how we have to handle in such condition, such a situation? So here also, if the patient is not the patient cannot continue the treatment, then in that condition, if the person is having any pitta or rakta lakshana, then you have to give medicines for pitta and rakta, and better to go for one mrudu virejana, that is the avipatti or any mrudu virejana dravya, with the mrudu virejana dravya you can administer, and this should be given, that is mrudu virejana, it's mandatory. Acharya Kashyapa, Lashuna Uttama Matra, either 100 garlic bulb or garlic cloves. It should be garlic cloves. So that is one nice question, Vishnu Prasad. It has been said that Lashana should be kept in Madiradi Madhya overnight before preparing Rasayana. Can you please give the reason behind it scientifically, or else? So the speciality of Lashana is Amla Varjita Panjarasa. So that if you are adding or if you are keeping in Madhya, so this will have another rasa. So that may be the reason. And another question, if is there a scope of Lashana Rasayana in PCOD cases, sir? So PCOD also we can correlate with the Avaranajanya pathology. So surely there may be a relief, or there may be a result by giving Lashana Rasayana in PCOD.
Thank you so much, sir, for your interesting and thought-provoking session. Your insights, drawn from the years of experience, have undoubtedly deepened our understanding and provided a much-needed enlightenment to our minds.
Any
We are
other
sincerely
questions?
grateful for the time and knowledge you have shared with us today. Now, the time has come to formally acknowledge everyone who made this Sky Deepika session possible. I request Dr. Meghana Ma'am, Assistant Professor, Department of Kai Chikitsa, SDMCA Udupi, for the vote of thanks.
Good afternoon, everyone. Om Shri Dhanvantare Namaha. Om Shri Manjunathaya Namaha. It is my privilege to present the vote of thanks to this august gathering. I express my heartfelt gratitude to our Principal Dr. Mamata KV and Vice Principal Dr. Niranjan Rao for their continued support in various endeavours that we undertake. I thank Dr. Srilata Kamath, Head of the Department of Kaya Chikitsa, for her guidance and encouragement. I thank today's resource person, Dr. Madhusudan IK, Principal, PNPS Ayurveda Medical College, Kanyangar, for his vast clinical experience and for agreeing to sharing his clinical experience with us. Thank you, sir. I thank my colleagues, Dr. Veerakumar, Dr. Aniruddha, Dr. Shailesh, Dr. Shreya for their support. I thank the PG scholars of our department for successful conduction of this series. I thank all our delegates whose enthusiasm and active participation has reinforced our resolve to continue with this series. We will meet you all in the next session of Kaya Deepika. Thank you. Thank you everyone for being a part of this journey. We will see you all in the next edition of Kaya Deepika.
वीडियो एडिट करता ये फोन एत्तुకొని ಬಂದ್ರಾ